Hi. Hi everyone, I'm Tammy. I thought I would just do a little quick webinar for anyone who is interested about the pathology that I use in my clinic because my background's in pathology. So if anyone's actually listening right now rather than on the repeater later, feel free to pop your questions in the chat box. I will endeavour to answer all those questions for you because, yeah, like I said before, my background's in pathology. 10 years in hospitals and cancer research. So me and cells, we kind of get along. And then I retrained as a naturopath and I run a busy practice in Newcastle called Inspirational Health. So I've been running that 8-9 years now. So yeah, I'm really open to answering any questions that you have. And I hope that what I give you today is pretty valuable. So the reason that I love cells is because when I was doing cancer research, what we had to do was grow cells for testing them. So if we got a whole bunch of cells and put them in a petri dish, what would happen is if we had the right environment that they were living in, so the right fluid and the right kind of medium that they were sitting in, then everything would be really cool. We would put them in the incubator and they would come out perfect the next day and we could do our testing on them. If we had one thing different, so the same cells, but we had one thing different in that fluid that they were sitting in, like we changed a hormone or we changed a vitamin or mineral or we changed the pH to acidic or to alkaline, then we would end up with an entirely different kind of response for the cells. And if we put them in and out of an environment that they didn't like very much, so the incubator was wrong or we left them on the bench for too long or we kept checking up and down on the lid, then they tend to die or apoptose, or they'd overgrow, so we'd start to have tumour growth, or they'd get mycoplasma infections. So my love of cells has come all the way from there. And I really love pathology results for that exact reason. You can check what's in that fluid. You can check the environment and how it's been affecting what those cells are sitting in for your clients. So I've just got a couple of notes because I thought, oh, I better write something down if you guys are going to listen. So regular pathology. Oh, we've got some more viewers. So feel free to click into the chat box any questions that you have. Regular pathology. I'll start with the full blood count. So full blood counts are general pathology that you could also kind of do a count on in live blood analysis if you're a HemoView practitioner like I am. Full blood counts tell you about what the red blood cells are doing, so what the oxygen kind of capacity is for people. If their iron or B12 is low, it's going to change their hemoglobin. And it also tells you about their white blood cell count. White blood cells come in 5 different varieties. First one is neutrophils. Neutrophils look after bacteria. So if they spike, then you've got a bacterial thing going on. Next one's lymphocytes. They look after and kill viruses. So if they've spiked, then most of the time it's got to do with a viral kind of picture. The next one is monocytes, and monocytes are detective cells. So they go around and check out whether or not there is anything to kill, but they don't do the killing. So they're usually there just before a kind of attack of some kind of infection. And then the next one's eosinophils. I see eosinophilia a lot in school kids because eosinophils rise when you've got parasites. They also rise when you've got a histamine response. So people who have allergies or intolerances can also have a heightened amount of eosinophils. So you've always got to do the back checking to find out if they've got a history of being around animals or growing up in a rural area or been overseas and never been the same since with their tummies. The other one's basophils, and it's similar to eosinophils, but they're a lot rarer. Next one, LFTs and EUCs. So liver function test and electrolytes, urea and creatinine. They are supposed to check your liver and your kidneys. That's not necessarily the case. They're checking enzymes that come out of that system. So your liver is like a big factory. and it opens its doors later on in the night, like we all know, and it has phase 1 and phase 2, and then we've got these end products. And those end products, those enzymes, is what you're actually testing when you're testing LFTs. So you're not actually testing the function of the first phase and then the other little phase 2s. You're actually testing these end enzymes. So for doctors, especially, regular pathology is great because it checks for whether or not you're about to die or you've got hepatitis or you have to go to hospital, but it doesn't test for the optimal kind of health. So when people have got enzymes that have risen, like you should have got on the spreadsheet, if you haven't got the spreadsheet, flick me an email at tammy@tammyguest.com. And I'll send you the spreadsheet that just gives you an idea about what vitamins and minerals might be useful depending on which enzymes are either high or low, and checking out what you might need to do for things like when GGTs go up and you need to check on their alcohol content, or if their protein is a bit low and you might need to check on how they're absorbing, or if their ALT and AST are up and you might need to check on their vitamin and mineral status in Bs and magnesium, as well as the way that they're dealing with their proteins. ECs is kidneys, and usually this has a flow-on effect for blood pressure as well, so you've got to kind of check in on them. Iron is an interesting one. So everyone says, oh, iron studies, if they end up being in the same, oh, sorry, I'll just get comfy. Iron studies are come in 4 different hits. There's iron, then there is ferritin, and then there is transferrin, and then there's the saturation. So it's a bit like, how I remember it is, it's a bit like iron is the cash. So you wander around with cash in your wallet all the time. And most of us would like to have a $20 note. So it's nice to have 20 iron in your cash, so that when you're running around and you're spending it, even if you're literally just running, you're going to expend iron. So running or using any oxygen is going to expend the iron that you have. Stress will do it. Other bits and pieces in blood loss and things like that, so periods and stuff, will expend your iron as well. So once you run out of that cash, you've then got to go into your savings account, but you've got to go in with a cash card, and so that's transferrin. Transferrin is, you go over, so if the card isn't working very well, then you're not going to be able to get those savings over into your wallet. So you need to check whether or not that's functioning. So if it's within the reference range, or if it's too low, then you're going to have a problem with the savings. So savings is ferritin. So if your savings account, you want to have like, $100 in your savings account. Lots and lots of women that I treat have a lot less than that. And you really don't want less than a $20 note, because if you're going in there and trying to get the savings out, you want to at least get a chunk and be able to utilize it. So like it says on the spreadsheet, you need to have somewhere between 10 and 25 for your iron, so that you can go run around and use the cash. You need to make sure that there's enough savings left over so that you can go in and grab that when you need to, and you need the cash card to be working properly. The percentage that comes in the iron studies, it's a really important number. If you double that percentage, it tells you about the saturation. So for most people, for most laboratories, it's somewhere between like 10 and 50% saturation, it says. But if you double it, it'll give you how much saturation they've actually got. So if they're at 50% saturation that it says on there, you can take it as 100%. So they don't actually need more iron. Their body's not craving more iron. But if it's down at like the 10 and 20 type of mark, then obviously their body wants more iron, so they're going into the ferritin to try and get the iron out to be useful for them. Cool. Again, I think I've got the chat box in here. Feel free to ask any questions that you feel like asking. Right, iron, B12. B12 is an interesting one. When I was doing pathology 15, 16 years, 17 years ago, they had really different reference ranges, and they had different reference ranges for B12, and they've got really different ones for thyroid, TSH, and things like that, but we'll get to that in a minute. So B12, it starts fairly low at 150 for some laboratories here in Australia, and it goes up to about 750 for some, but the ideal amount's about 500. So if your B12 is sitting around about 500, then you've got the ability to get focus and concentration and get oxygen to your brain, because that's what B12 does. It sits inside your little red blood cells and helps iron carry oxygen around. And if you're low in it, then you end up having these really big red blood cells, which comes up on the FBC, the full blood count. And those really big red blood cells can't hold on to the oxygen. So B12 needs to be about 500. If it's less than that, you want to focus on how to get that up. For some people who are affected by MTHFR, then you want to be thinking about activated Bs, but of course take it all into conjunction with your clinical case taking as well. Next one's folate. Folate and B12 go together. And again, there's lots of conjecture about MTHFR, but you want to have that relatively high because folate's used in so many different pathways. And if you're having a hard time getting the B12 and the folate up, then I would seriously consider going and getting the MTHFR test. MTHFR can be done through HealthScope. HealthScope I generally use, and I also use Naturopath as my functional pathology laboratories that I refer to. And the HealthScope does MTHFR for about $60, and you can get a blood test or you can get a swab. So there isn't really all that much difference in accuracy. It's just, swabs are much easier for kids to do. Blood is much easier for adults to do. People with needle phobias, stuff like that. It's still DNA, so it's still going to be on the cells that you're taking out of the body. Next one, ESR and CRP. So ESR and CRP are inflammatory markers, and ESR is the long-term inflammatory marker. So we're talking about chronic kind of conditions, and CRP is one that will rise in an instant. So if you've got a cold or a flu, sometimes CRP can go up. So C-reactive protein is what it's called. Both of those should be 0 because you don't want any inflammation in the body. So the closer they are to 0, the better off you are. Although doctors won't recognise that necessarily, but that's the way I would choose to look at it, because inflammation is not exactly ideal in any kind of way, shape or form in a high amount. Next one, thyroid. So like it says on the spreadsheet, thyroid is an interesting one where they've changed the reference ranges depending on what drugs are available. So they ran out of Eroxin. Well, there has been stints over time where Australia has been really low on Eroxin, and Eroxin's the drug of choice for thyroid conditions. And what they were doing was, originally TSH was somewhere around 1.0 to 2.0 thyroid stimulating hormone, and 1.0 to 2.0 is the ideal. If you're less than 1.0, then it's very likely that your thyroid's in that subclinical hyperthyroid kind of range. So it's going really fast, it's speeding up metabolism, getting a whole bunch of anxiety-driven stuff happening. After 2.0, then you're getting subclinical hypothyroid type of symptoms, again, depending on the clinical picture. But generally what I find in clinic is when a TSH is higher than 2.0 and they do have the slow metabolism, the gut stuff, the hair falling out, the tendency to feel cold, the inability to lose weight kind of stuff, then you're looking at a subclinical hypo kind of condition. I then go on to check selenium, iodine and vitamin D. Selenium, iodine and vitamin D are essential for your thyroid to work properly, and given that 1 in 3 women in Australia have low iodine and low vitamin D, it's pretty much a given. When you go on and check those, vitamin D needs to be about 100 to be functioning properly for allergies, functioning properly for your thyroid, functioning properly for your osteoporosis risk. And vitamin D is actually a misnomer. It's a hormone, not a vitamin. It has hormone-like responses rather than vitamin-like responses. So yeah, it needs to be about 100. Iodine also needs to be about 100. And 1 in 3 women in Australia don't have enough iodine. We don't have a lot in our soil. And we don't eat seaweed. So that's a really good one to check. I often see thyroid stuff, subclinical thyroid stuff, just specifically coming from those. And once you bring up the vitamin D and the iodine to the amount that they need to be, then most of those subclinical kind of symptoms disappear. Ideally with your TSH, doctors will just check the TSH. So if it's somewhere between 0.3 for some labs and 5.5, so 0.3 to 5.5 when you want your ideal to be 1.0 to 2.0, is a huge amount of leeway. And when it's within that, then doctors won't do anything about it. But what I see in clinic is heaps of really obvious grey area where they're not feeling great, and all of those metabolic kind of things are happening, but they're not in the black zone that the doctors can do anything about it. So we're really lucky that we're able to kind of hit on the mark there. There's a whole bunch of herbs you can help with that as well. I'm sure you all know about that. But if it's in that grey area, I still often check the rest of the thyroid ones. So there's 5 thyroids that I check. It's TSH, T3, T4, reverse T3, and I do antibodies as well. You can get all of those on the Health Scope. Yeah. And then if you've checked all of those, usually the reverse T3 is the one that'll come back with a query on it. And often I've seen it a lot where doctors have missed the antibodies as well. And then I go on to check vitamin D, selenium, and iodine. Okay. Has anyone got any questions? Let me just check. I haven't run one of these for a while. I just want to make sure that I'm not missing anything. So you should be able to find a chat box over on the side if you wanted to ask me any questions. Next, functional pathology. So functional pathology is a little bit different. Like I said before, and if you just joined us, I use HealthScope and I also use naturopath, and both of those I find really good. I'm in New South Wales, so up north there's different ones, over in New Zealand there's different ones, and down south there's different ones as well. But I use them predominantly because they're because of my background. I know that the labs are really well run and they meet certain standards and all that kind of stuff. And I find HealthScope in particular, I think we all saw on the feed that their practitioner manual is fantastic. It's unfortunately it now costs money to buy it. Didn't used to, but it's really, really, really good. So I'm going to kind of run down the top 5 tests that I get done through them and why you would use them. And yeah, so again, ask any questions you want. So CDSA. CDSA is complete digestive stool analysis, and there's 4 or 5 levels now. I use CDSA 2 regularly, very, very frequently with my clients. I get referrals from local GPs and a specialist in the area, specifically for IBS. It just happened to be like that. I focus predominantly on adrenal fatigue in my clinic, but IBS kind of seems to be the thing that everyone comes for. CDSA is great because it doesn't just tell you about what's happening with the bugs in the gut. It also tells you about digestive capacity, so it breaks down what the poo looked like. It breaks down how the poo was broken down, so it tells you about how they're breaking down proteins, how they're breaking down fats, how they're breaking down carbohydrates, if there's fibres left in there, what type of fibres they are, that kind of stuff. So it gives you a kind of pointer as to where you might be looking digestively that might have a problem. And then below that we've got then we've got short chain fatty acids, so breakdown products of things that are fermenting within the gut and how they're breaking down. It'll give you pointers on whether they need enzymes or HCl or that kind of stuff. And then my gutsy stuff, so my background's in micro, so I love the breakdown of all the little bugs. So there's probiotics. They give you 4 specific probiotic strains that they're looking for, and what kind of reference range they're in, so if they're high, medium or low. And then they'll give you the parasitology, so they tell you whether or not there's blasto or dientamoeba or giardia, or there seems to be a lot of that up here in Newcastle. So then they give you the parasites. They also give you other species, so often there's candida, multitudes of different species of candida. Candida albicans is one of them, but Candida glabrei is a little one that we get fairly frequently up here, and it's really difficult to get rid of. And then they've got some others like Klebsiella or Enterobacter, which are commensal organisms that when they're sitting there, they're fine, but when they overgrow, you start to have IBS types of issues. So they tell you the good, the bad, the ugly, and down the bottom, they've kind of got this scale that they've made up themselves about a dysbiosis scale. So it tells you how far gone or how affected that person's gastrointestinal tract should be based on the stool analysis that they've done. So I find it really helpful, the CDSA2, and the others can be helpful depending on what type of presentation you've got. So for some people who have had testing before, or they're having a recurrence, or what I see as a recurrence of something like blasto or giardia, then I get the higher kind of CDSA 3s or CDSA 4s to make sure that we're testing against something that's going to kill it. Because you can't, yeah, the further up you're going to be able to, they grow the poo on a plate, they grow all the bugs on there, and then they're able to test what against those bugs, what they're actually going to respond to. And they also do herbs in there as well, black walnut and things like that. So they're really, really helpful. And in some cases, and it's because of my background in micro, some cases I do use the local doctors to be able to give them antibiotics, because that's what their particular bug within their gut has responded to, and hasn't necessarily responded to the herbs that they've grown within the lab. So yeah, CDSA2. Next, FLDP. FLDP, Functional Liver Detoxification Profile. This is a fantastic, fantastic test. It's a salivary test. It's a wee and a spit. So the clients also have to take aspirin, and they also have to take a caffeine tablet. So for some people that can be a bit sensitive, but the reason that it's sensitive in the first place and they can't take those things, or they feel like they can't, is because their liver is not doing what it's supposed to be doing. So FLDP measures, or shows you a measure of, how the phase 1 and the phase 2 pathways are either working overtime or in most cases under time. And that means that there is a buildup of certain toxins, or buildup of certain hormones, or buildup of certain reactions in the body that are coming from that. So I use FLDP when whenever there's a hormonal migraine kind of picture. And every single person that I've tested for it, the glutathione pathway, every single one, I should write something on that, has a low glutathione. Glutathione is a pathway that looks after a whole bunch of different stuff, processes a whole bunch of different stuff, and if it's too low, then you start to have, yeah, migraines, sensitivities to foods, hormone issues, possibly heavy metal toxicity as well, because it's the one that basically gets heavy metals out. So that's the first part of FLDP. Next part down is the phase 2, and I also use it for checking out other hormone-related disorders like estrogen dominance, and in some cases PCOS, and in others for salicylate sensitivities and things like that. It's all because there's something in there that isn't being processed correctly, and then once you identify which ones they are, HealthScope is really good at giving you indicators on what to look at. So in the report, it tells you about if your phase 1 is not working, it's not working because of this particular reason, and these are the nutrients that you might want to look at, these are the herbs you might want to look at, and these are the lifestyle kind of things that you might want to look at. So in the case of glycination, which looks after salicylates, it has a little bit down the bottom that they automatically pop up that says minimizing salicylates, making sure that you've got cofactors like cysteine in there, magnesium and B6. So there's a whole bunch of little tips and tricks there that basically give you the information in the first place. Again, you take all that information with your clinical questioning and the clinical picture, and you kind of run with it there. Cool. Any questions? Okay, CDSA, FLDP. Next one, salivary hormone testing. So I use this a lot too. Again, my practice is predominantly women with adrenal fatigue type of issues, and when when I want to check out what's happening with someone's hormones and they haven't gone and got them tested from the doctor, or they have gone and got them tested from the doctor and it's appeared normal. Serum hormone levels are the excess hormones that are floating around in your body, not necessarily being used. Salivary hormones are an indicator of the hormone levels within the tissues. And so because your hormones are actually being used within the tissues, they're not being used just to float around your body. I find it a really great tool to be able to get an indicator as to where somebody's hormone levels are cellularly. So the cool thing about it as well that doctors won't generally check with women is that they get DHEA and testosterone checked. Most doctors will only do estrogen, progesterone, or E2, which is one type of estrogen, whereas salivary hormone does 3 types of estrogen, 2 of which are pro-inflammatory, so that can be a really good indicator for some kind of conditions like endometriosis and other bits and pieces. So there's, yeah, they'll usually do OD, estradiol, E2, progesterone, and they'll, depending on if it's PCOS, they'll do luteinizing hormone and follicle stimulating hormone, which is great. But in a lot of cases, the ratio between the estrogens is really important. The ratio between the estrogen and progesterone is really important. The testosterone and the DHEA is really important. And to get that whole clinical picture, it's really great to be able to do all that through the salivary hormone testing. Those types of tests, yeah, like I said, I use for PCOS, endometriosis, fertility issues, hirsutism, and a lot of adrenal fatigue stuff. So with my adrenal fatigue peeps, what happens is they are mostly really interested in concrete information and how to, and they want to get it done fast and they want to understand how it's working. So cortisol is great. Cortisol is really difficult to test blood-wise. AM cortisol that you get tested with the doctors will kind of be high anyway. If you're going to the doctors and you're running late and then you're about to go and get a needle stuck in your arm, then your cortisol is going to rise. So it's not really the most ideal indicator. Whereas the salivary cortisol testing, you get 4 tubes to spit into, and it's a really great opportunity that you're going to do it at home and in the comfort of your own home where you're nice and relatively calm compared to getting a needle in your arm. And you get to see what happens during the day. Cortisol's fantastic as a tool, and the HealthScopes graph that they have on their printout is fantastic. It's got a beautiful little green zone, and it's really obvious to the client when theirs goes in the opposite direction, and when their results are actually out. So I find that it can change within 3 to 6 months. So you get it tested the next 3 months or 6 months down the track, and you've been doing all your herbs, your vitamins, your lifestyle kind of advice around stress and mindfulness and things like that, and it can really change the way that their hormone levels are, as well as their life. So really good information. So that's CDSA, FLDP, salivary hormones, adrenal hormone profile, and last one is some of the standout singles. So iodine is iodine's a urine test, a spot urine test, and they can check again what level your iodine's at, which is really helpful in fibrocystic breast disorders and thyroid kind of conditions, and stubborn kind of weight kind of gain stuff. Then there's they've got straight vitamin D, they've also got straight Bs, they've also got red cell zinc. So zinc that most of the doctors check for, well, most of the minerals that the doctors check for are serum, which is totally useless because they're not actually attached to the cells, they're not being utilized that way. So you want to do the red cell version of them. So red cell zinc or red cell magnesium is much more useful information than the serum magnesium or serum zinc. MTHFR, if you missed it before, MTHFR is really easy to test. It only costs about $60 through HealthScope, and I use it a lot, especially for people who are tired even though you've given them B vitamins. And all of the other things that go with MTHFR. Ben Lynch is fantastic at all that. So if you haven't checked out all of that stuff yet, so is Rachel Arthur. She's amazing with all of that, the MTHFR kind of side of things as well. But testing it is really, really easy. $60. It's a swab on the inside of your mouth, or it could be a blood tube as well. MTHFR. Oh, and cryptopyrrole. So pyrolurea is another test. I use naturopaths to do that because their turnaround time's quicker. And you can only get cryptopyrroles done with HealthScope in Victoria. So the pyrroles testing is a urine test in the dark, which can be a little bit difficult for some kids especially, but it's fantastic. That you've got to keep in mind that they have to be really, really careful of taking the sample, because if it is open to the light, then it's compromised, the result's compromised. So yes, cryptopyrroles in the dark. Really useful for any of the alphabet disorders, ADHD, ADD, OCD, all that kind of stuff. And it gives you an indicator whether or not zinc and B6 can be an issue. And other places to look for information on that's the Pfeiffer Institute and the Pfeiffer protocols. Lastly, live blood. So live blood analysis, I was really anti-live blood analysis. Given my background in haematology, I was sure that it wasn't going to work the same. And it really doesn't, which is great because you get to see these cells that are alive. So everyone asked me what I think about it, so I thought I'd just plug that on the end. Cells that are alive are very different to the cells. When you take someone's blood and you put it into an EDTA bottle, basically what that purple lid bottle that people get their blood taken in, it basically freeze frames all of the cells. So it kills them and kind of stasises them. But you can't see the actual activity of them. And so in live blood analysis, we take that drop of blood and you're actually seeing it clot in front of you. You're actually seeing the mechanism by which it's clotting. You're actually seeing the way that the white blood cells are moving around the screen. You're actually seeing the function of them. And that's that regular pathology versus the functional pathology. Regular kind of medical care versus functional medical care. So we're there optimizing function. So we should be looking at the function. If we're there just saying black or white, should be in hospital, shouldn't be in hospital, should pass away, shouldn't pass away, that there's a really clear difference for me when I'm talking about pathology, when to use certain things and when they're going to be really beneficial. So live blood, I love live blood, and I think if anyone's interested in doing that, they need to do a little bit more research themselves on how, what to look out for from a functional perspective for those cells. There's a guy, what's his name? He's up in Brisbane. Can't remember his name, but he's a bit of a genius, maverick on it. His background's in pathology as well, and we've had some really good chats whenever I've had to go and do the hemaview training or the advanced hemaview training. Is really good. So hopefully, if you haven't asked any questions, I'm hoping it's working. If you haven't, yep, it says it's working. If you haven't asked any questions and everything in here has hopefully been helpful, if you want to find me after this, I'm at, my clinic is inspirationalhealth.com.au. My work website is tammyguest.com. So that's where I help entrepreneurs and adrenal fatiguers. And I also mentor and help local and Australian naturopaths build their businesses as well. So you can find me at inspiremybusiness.com.au. So hopefully it's been helpful. And if you need any other questions, you can find me on Facebook as well. Just flick me a little message, or tammy@tammyguest.com if you haven't got your hands on the spreadsheet. All right, thank you so much for listening. Bye.